Big, you ready? A big part of our practice in the alternative area is the use of high quality, high cell count probiotic therapy. There are some 101 problems that are linked to 101 health conditions that are linked to unbalanced gut bugs. Now, we've been very successful working with Dave Sullivan from the University of Wisconsin and Kelly Karpa, who's written a book called Bacteria for Breakfast, Probiotics for Good Health. And this is the best textbook ever written on the subject.
Yeah, let me
And
see
then
if we can see the title. There you go.
And then Dave Sullivan provided us with this health benefits of FOS, and these two together make up what we call symbiotic therapy. So the consumption of 1 capsule a day of Fluorogen 3 and adding a 1/4 teaspoon of this FOS causes the cells to multiply 5 times faster and make short-chain fatty acids, which are needed to nourish the entire intestinal tract cells. Now, what was interesting is yesterday on Mercola.com, there was a Dr. Natasha McBride that was giving a lecture about how all this autism and all these psychiatric disorders in children with ADD, ADHD, dyslexia, and so on were linked to the quality of the baby's intestinal tract health, whether they were ready or not for immunizations. And she suggested that the babies could be tested for the strength of the baby's gut microorganisms, which is an indication of the baby's immune system. And if the baby's immune system wasn't in good shape, they could be triggering a lot of these psychiatric problems by giving the babies immunizations. So that was just yesterday, and that was a huge finding because in '85, when Dr. Natasha had a child who was autistic, she researched all this stuff, and the statistics back then were 1 out of 10,000 babies were autistic, and now it's something like 1 out of 150. And she predicts that that number is going to continue to grow. She postulates that, well, we know antibiotics will unbalance the gut, but she also suggests that birth control pills would also play a role on the mother's intestinal tract health, and that is where the baby gets its immune system. And so she's suggesting that there's some deficiencies in the baby's immune system and they may or may not be ready, but it's hard to tell without doing some further testing as to whether they're ready for the immunizations. And the immunizations can cause some problems if the baby's immune system isn't ready to accept it. So that's a new twist in symbiotic therapy.
Thank you, Bob. This is Robert Lasecki at Glen Ellyn Pharmacy, Glen Ellyn, Illinois.